here. Thank you for joining us. We're happy to welcome you to this regular meeting for our labor leaders in the community. By regular, I mean our monthly meetings, to have a check-in with our public health leader, Dr. Santora. We are excited to have you. There's a lot of really important information that's going to be shared today, and that has been ongoing over the last week. So the timing is perfect for this meeting. And I would like to not take any more time and turn it right over to you, Lisa, to begin our presentation. And Melina, thanks for your help with that.
Thanks, Melina. You can jump right ahead. Happy Monday, everyone. So this is just a reminder, we are on a regular schedule. We really value this time with you, and we might move pretty quickly today because I think many people have already seen many of the significant updates, and we want to respect everyone's time, but this really is your time to have direct access to public health and ask any questions or concerns, especially as we change our policies, which we had a pretty momentous week last week in relaxing our policies and also announcing criteria around ending the mask mandate. So you can jump ahead. So this is the new slide that is our lead slide all of the time. I didn't get a chance to check it this afternoon. CDC Updates its community tracker sometimes twice a day. You'll see that the nation is still in red, but California is still leading the way in substantial transmission. We now have 133 cases reported over the past week, which has us right at the border of moderate transmission. So it's we expect that as early as this afternoon or as early as tomorrow, we might shift again into the moderate levels of transmission. But we would expect in this first week again for it just to be wobbly, that knowing we bounce back and forth because of such frequent updates from Centers for Disease Control. And just for you, this is just for the nerds among you, what the state of California did when we had the blueprint is they had a 7-day lag in reporting, because we knew we always had delays in tests actually getting entered into the system for calculation. And the CDC does not have that lag. And that's why it's so variable and so fluctuating. So every minute, literally, new reports of tests completed are going into this living database. So you can jump ahead. But the news is good. You can see on our own chart here is that even among our unvaccinated groups, we are seeing significant reductions in our case rates. Still high in that unvaccinated group at 16.5 per 100,000. But just remember that this is a significantly smaller group. It's around just over 40,000, between 40 to 50,000 residents in our community that remain unvaccinated, and around 18,000 of eligible people who remain unvaccinated. We can jump ahead. So what we're following, this is as we follow COVID transmission, it's driven not only by COVID behavior, the behavior of the virus, but also driven more by our own behavior. And we know we're coming into Halloween and Dia de los Muertos, which are big celebrations for all. So we have recommendations. I have already started buying Halloween costumes for my family. We're planning on going out and trick-or-treating. And just again, really back to the basics, really think of keeping it small. If you are indoors, wear a face mask, especially if your children are under 12 and mingling with other kids. Maximize that time outdoors. Hopefully it's not raining for this Halloween. And then while you're out and about, just try and practice as much distancing and using hand hygiene as you can. And then just knowing if you did attend a holiday event to really monitor for symptoms the 14 days after attending an event. Remember, there is breakthrough cases, and this is just the classic scenario we hear in public health is someone attended a higher risk event. A couple of days later, they develop symptoms, whether they're vaccinated or not. And that's when they have found out that they been diagnosed with COVID-19. So just monitor for symptoms. You can jump ahead. And I've shared this before, but I added some icons. We are doing very well in reducing our case counts, but we do learn from the past. And it was right after Halloween where we started seeing an uptick in cases that resulted in our third large wave. And as I mentioned, human behavior, we know it's Halloween, we know Thanksgiving is coming, and then we know our winter holidays increase travel significantly and move people indoors. So I am not anticipating a third wave like this, but we are prepared to return possibly to moderate transmission, just like we saw last year. Jump ahead. This is our mask update. we've had a lot of new policies released last week. So we're really proud again that we stayed in step with the Greater Bay Area region. 9 health officers came together and developed a consensus opinion, which is hard to do with 9 health officers. They're all independent physicians and scientists trying to interpret data and make the best decisions for their community. But I'm proud that we developed a shared criteria for when we would end the mandate on indoor mask restrictions. And just to remember, you may have heard it on the news, it's still recommended to wear a mask indoors. And even when we end the mandate itself, it probably will still be recommended to wear a mask indoors, whether you're vaccinated or not, especially if you have someone that's unvaccinated at home or immunocompromised at home. So we're going to look at 3 factors, the transmission levels, like I showed in the beginning, our hospitalizations, and our vaccination progress. You can jump to the next slide, and this is where you'll see some good news. We are already achieved 2 out of the 3 criteria for ending the mask mandate. So what we are waiting on is that number 1 is seeing the COVID-19 transmission return to moderate or yellow level of transmission. And the reason probably most common question I've heard is, why is it 3 weeks instead of 2 weeks? If you remember, the blueprint used 2 weeks. And the reason the health officers opted for 3 weeks was really because Delta is very different than the Alpha variant that we were managing in the beginning of the pandemic, just due to the high levels of contagiousness. Also knowing we're coming into a winter season where we've learned from the past that it's a higher risk for having a surge in COVID activity due to our own human behaviors. And also the fact that we've relaxed so much that we also are anticipating to see increases in flu, RSV, and other viruses and illnesses, bacterial illnesses that can cause hospitalization. So 3 weeks was the consensus opinion. Again, there are 9 different opinions, but 3 weeks is where the consensus landed. Jump ahead. And there is a new exemption. You may have also seen this. I think the most common setting that you'll see this is in gym and fitness centers. This has been one of the areas that many of our residents have been frustrated with the return of the mask mandate, is when having to go and work out. And we really appreciate how physical activity is really important, especially as it gets colder outside, and having the availability of a fitness center to stay healthy, especially as we navigate a pandemic. So this gives an exemption if a host employer organization follows very strict criteria. So every individual present in these eligible settings has to be vaccinated. There cannot be any exemptions, no religious exemptions, no medical exemptions. Everyone needs to be vaccinated. They need to be able to maintain a list of the individuals who are present. Can't be more than 100 people, and it cannot be open to the general public. So it's a controlled setting. So we'll have more information to come, but just to remember that schools do not fall under this, because schools are under a different order or law from the state, and all indoor settings at this point in the school setting are required to have masks indoors. So there is not an exemption in the school setting at this time. Jump ahead. Vaccine updates. The other part of my world is vaccination. So you already saw the nice green checkbox. We have already achieved that 80% of fully immunized in our community. And that's even with a significant number of individuals who are not immunized because of their personal decision or because they're ineligible. So we're really proud of this achievement. It's, I think, one of the first in the nation, if not the first, to have 80% of all eligible residents 80% of our total population fully vaccinated. Can jump ahead. So we get our news just like you. Pfizer announced on Twitter on the 7th that they submitted for EUA authorization, and that keeps us on target for the dates of our scheduled pediatric clinics. Again, this is going to be a 2-dose regimen for children 5 to 11. It's a third of the original dose of the vaccine. So a 12-year-old would have a higher dose, and then the 11-year-old, and it's because of such the strong immune response that we've seen from the 5 to 11-year-old group who participated in these studies. So we are on track for the end of October, launching our first vaccination for this 5 to 11 age group. Jump ahead. And we really appreciate that we've been sharing a message that children really, and you have seen it firsthand, children really do have no to mild symptoms when they are infected with COVID-19. So we know a lot of parents are going to be having questions around the risk and benefits of vaccination, especially for this younger age group. So we have 2 panel discussions. One will be in English with Dr. Ruel and Dr. Greenhow, who are both pediatric infectious disease specialists. And we're really fortunate to have very talented residents in Marin County who share their talents with our community. So we're excited to have them on board. And then we'll be having a Spanish language presentation with Dr. Simon and Dr. Matola. Both Dr. Simon's a family physician from Marin Community Clinics, and Dr. Matola is a pediatrician from Kaiser. And so we're excited to be having these 2 events. We'll also be posting, it was just confirmed today, we'll be having an in-person event at Rocky Graham Park on October 21st at 5 p.m. where I'll be joined by other physicians in the community, have an in-person session where parents can come and answer questions about the vaccine again, and the risks and benefits of getting their children vaccinated. Jump ahead. Do you want to jump in here, Mike? We're just going to through these next slides where these are the dates that we have scheduled for our first and second dose pediatric super pod. So we're just really appreciative of the partnership with the school districts and the schools themselves. This is a heavy lift. And I know you've been getting lots of emails requesting volunteers to support these super pods, but we have set a goal, and to achieve that goal, we're following our practices in the past by offering super pods for this population. Anything else to add, Mike?
Yeah, I just thanked to Kimberly and Becky. We did our walkthrough at Miller Creek on Friday, and we were just out at Strawberry Point this afternoon with the public health team. And I think we've got a good plan in place. And of course, all of this is dependent upon the timing of not only the authorization, but when the product, the diluted Pfizer product, is packaged and ready and shipped. So, this is like a pretty aggressive time frame. And the thinking is that, we're doing a tour at Novato High School tomorrow, but the very first weekend, October 30th and 31st, if we're just not ready to go with the product or the approval, we'll hold all the rest of the dates, and we'll just leapfrog and put the October 30th dates at the, we'll push their second dose dates will become their first dose dates, and so forth. But
there'll be like a snow day.
A snow day, right? And we're our volunteer, we're really pushing. We need some more school volunteers. We've got 15 school volunteers, 15 volunteer slots every morning from about 8 to 12:30, and then 15 slots in the afternoon from 12 to 6. And we're getting close, but we're going to still appreciate all your support in helping us get the word out for these great volunteer opportunities. We're going to try to make it fun and engaging, and have music and crayons and kid-friendly, supportive environment. So we're looking forward to it.
That's great. You can jump ahead to the next slide. This answers Morgan's question. So we are targeting some of our lower income schools where we'll be on site during the school day. So we'll be working with the schools to have consents completed in advance. And so this is especially important for working parents who may not be able to take their children to super pod days on the weekend. Wanted to make sure we had access in the community. And we'll also be partnering with Canal Alliance to offer pediatric vaccinations in the canal as well. And then our Kerner campus, which is the health and wellness campus by the Cardenas market now, Cardenas market, will be open Thursday through Saturday weekly. So we will have a strong presence for vaccination in the canal. Jump ahead. And just to point out, there is a sensory day. We had a successful event when we did the adolescent rollout. We recognize that there are some students with access and functional needs and who need more supports, and not the more craziness of a mass pod or point of dispensing site. So we're calling it our sensory clinic, where again, it's a lower volume clinic with a much more supportive environment and child life specialists on site there. And again, these are just more of we're calling them mini pods. So we're really trying to focus on our low HPI communities, that's lower income communities and communities of color within Marin County, to make sure they have enhanced access to vaccinations for their family members. And I think at many of these sites, we were ready to vaccinate not just that 5 to 11-year-old population, but family members who come with their children or students will be able to get vaccinated as well. Jump ahead. So boosters. As school staff, you are eligible for boosters. It is a a strong recommendation from the CDC that individuals over the age of 65 get a booster shot, and 55 to 64 if there's additional medical conditions to get a booster shot. We just looked at our own data and we saw of the breakthrough cases, and that's cases who are vaccinated and hospitalized, 77% were over the age of 65 years old, which really, it's a small number. And we only had 24 total breakthrough hospitalizations, which for us is really reassuring. It shows how effective the vaccines are at preventing hospitalizations. Like I've said consistently, 80 to 90% of hospitalizations are among unvaccinated, but among those breakthrough hospitalizations, the majority, or 77% of that total 24, were over the age of 65, which again, it's small data, but it supports offering the booster shot to individuals who are over the age of 65. And then if you're school staff and you're under the age of 55, you're still eligible. You just, we would just encourage you to you don't have the same risk for severe disease or hospitalization if you don't get boosted, but we would encourage you to just consider it based on your own individual health and personal beliefs about the vaccine. And just to say, we've heard this week that the FDA is going to be meeting around Moderna and the Johnson & Johnson product. We do anticipate that they'll possibly as early as the end of this week, they'll have recommendations regarding those booster shots as well. Jump ahead. And Northgate Mall is open. We saw after Mike sent out the email to the school community, we saw a lot more teachers show up to the Northgate site, and we were really happy to see everyone there. So you're more than welcome to the Northgate site. It's either can sign up or you can just walk in while you're doing your Halloween shopping right next to the spirit store. So we were really excited to announce, even though we haven't met criteria for ending the mask mandate, we definitely have learned based on the strength of our safety plans and the effectiveness of our safety plans and very low levels of school-based transmission that we are ready to move to mitigation level B, and it's effective today, which is really exciting news. And so I'm just going to run through the guidance on numbers, or the changes as that we made effective today. So you can jump to the next slide. So we were in the past, and number 8 just said you have to follow what Marin Public Health is recommending for testing. Now we have a very specific recommendation for testing. We're asking all schools and school districts to enroll in the California COVID-19 school testing program. That's going to bring additional resources and supports to our community. We have a big team working on all fronts, trying to make this work and to jump through some of the bureaucracy and administrative burdens to make this a viable testing option in our community. But we really see this as the next step for self-sufficiency in testing at the school level. Number 9 was just a correction in the link and the language, so nothing significant about number 9. Anything you want to say about the testing program, Mike, before we jump ahead?
Yeah, so it's just going to be a process. I mean, in other words, we've done it. We have the experience. I know there's a handful of districts and schools in the county have signed up through CDPH, and you have to do an MOU, and then there's creating a login with the primary health portal. It's a little bit of a process, but once you're in, you've got full access to all the resources and some great training. And I know your team, Lisa, is going to be providing technical assistance. Thursday at 10, we're going to have our first kind of technical assistance, how to sign up and how to get into primary. And then the next step is to get our staff and students, families uploaded and enrolled in the system. So it's going to be a process. The way we look at it is we're going to try to do it over a multi-week period and just do it a step at a time. We're going to try to help everyone through.
Great. So you can jump ahead. So when we launched the school year with the high levels of Delta that we saw, we recommended that all large gatherings be held outdoors. Now we are stating that gatherings can be held indoors and outdoors. We know that the weather is about to change and it's going to get colder, and we are confident that we can have safe indoor assemblies. And following just the indoor events, wow, my accent almost came out. The order from the state that if there's 1,000 or more people attending, that they are required to have proof of vaccination or proof of a negative test. And the only scenarios that we've been hearing about are kind of like basketball games, indoor basketball games. And some of our larger high schools can sometimes have that large event. We are recommending don't just look at the 1,000 number and then try and reduce it to 950 in order to not have to follow that recommendation. This think of the spirit of it, it really, if you're going to have an indoor event and not have those measures in place, it's in the 500 to 750 range where you would have the more protection than if you just tried to, cut off a couple of attendees in order not to follow that 1,000 requirement. So people can no longer self-attest, so that it is an actual vaccine verification. So you may need more staffing and support in order to complete the verification process. Jump ahead. So previously we said that all meals should be held outdoors. Now we are saying meals should, they outside is always preferable. We know that COVID does not like the outdoors. And then when meals are served indoors, just to have assigned seating charts when feasible. That's the indoor eating is probably the highest risk activity. Lower risk in some of the larger rooms where kids eat. But what we commonly see is really in the staff break rooms, those smaller eating areas where there's been COVID activity and transmission. And it's again, really when you're eating and you're very close to people and if you are infected and you're an asymptomatic infected person, you have a risk of transmitting disease. So that's why we want the assigned seating chart. You can jump ahead. So this is the big one. This is what made many parents very happy, is that we have shifted from having, excuse me. That was pepper, not COVID. We shifted from strongly recommending masks be worn outdoors to aligning with CDC recommendations that outdoor masking is optional and that people don't need to wear masks outdoors in general with play and recess. We direct people to the CDC and California Department of Public Health for face covering guidance. What drove this is that with all of the exposure events that we've investigated now 200 exposure events. We have not seen outdoor transmission of COVID-19 in our school environments. Again, we're not seeing the transmission. We were worried in the beginning with the kind of the close activities that kids could have in the outdoor space, that they would be at higher risk with this more contagious Delta variant. But after more than 6 weeks in school now, we really have seen that outdoor transmission is not a primary route of transmission for the youth population or the school population. So we're very confident in having it optional.
Hey Lisa. One of the questions that came up today on our walkthrough at Strawberry Point is like, wow, today it's a big day. It's like masks are officially optional outside. Is there going to be any kind of announcement? And, my response was, well, we made the announcement through the release of these new guidelines, but is there anything more formal that we're going to do?
Nope.
Okay, there it is. Okay. Kimberly, you asked the question. There's the answer right there. Yeah. So again, these are guidelines, and I know some families, some schools may choose to continue to recommend.
We've heard of some schools. So we've heard some schools are continuing to have a policy for outdoor masking. We fully support schools that feel more comfortable with an outdoor masking policy. We also want to even more strongly support that there's families with different risk levels and different living conditions and might have more immunosuppressed family members at home, and really want to encourage people to be supportive of people that continue to wear their mask outdoors and be empathetic, because there might be reasons that are very reasonable for why they're continuing to wear a mask outdoors and necessary to wear a mask outdoors because they're protecting others in their household. So just be supportive of everyone as they're on their continuum of wearing a mask or not wearing a mask, as long as they're following the orders. So jump ahead.
Okay, so a question came up from Linda. Linda, you want to ask a question? This has to do with masks.
Yeah, sorry. Yeah, if the kids are going to go outside with their masks, they need to put them on before they come back into the classroom. Mm-hmm. So they have to store them outside somehow.
No, I mean, some kids, it's really up to, I think, the individual teacher in the school. Like our previous recommendation is put the mask in the brown bag. So a kid could have a brown bag and put their mask on their desk and then just put their mask in when they're back at their seat and put their mask back on. Or some kids just they put the mask on their wrist, and then when they come back in, they put the mask from their wrist to their face. So it's really up to the school, I guess, logistics of what would be preferred.
Okay, and then Sarah's got a question too. Sarah, actually, I saw Mariah too. I'm so good. Mariah, why don't you go first and then Sarah?
Sure. Can you hear me?
Yes.
Okay. I just have a question about singing and if students can sing outside with no masks.
Yeah, if they sing outside without a mask, they should be 6 feet apart.
Okay. Thank you.
All right, we'll wait for Sarah to get unmuted.
Okay,
Sarah, you can
okay.
interrupt us at any time.
Sarah can't unmute. And okay. Okay,
So
Sarah,
we
you have a
can-
question?
I can
Yes.
read Sarah's question.
That's great.
Will the outdoor optional masking guidelines change exposure quarantine? Quarantine versus modified quarantine?
No. So just to be clear, the question we're getting the most is there is no modified quarantine in the pre-K levels. So the modified quarantine is allowed in the TK through 12 grade levels, but in the pre-K levels, there is no modified quarantine. And then we're not considering, we went through our quarantine guidance and just made sure reconciled the outdoor guidance, the outdoor masking change with that. We don't consider any, unless it's a known, if it has to be a known close contact, unmasked outdoors is the only scenario that there would be a modified quarantine recommended. Because again, we have not seen outdoor transmission. So we've relaxed a lot of our quarantine recommendations already in the outdoor, for the outdoor exposure scenarios. And so our first question always when there's an exposure is what's the vaccination status? And then the second question is still, is there masking? But we're moving towards, again, relaxations of the quarantine recommendations, especially in the outdoor setting, which aligns with why the masks are also optional. And just for some members of this group, we had a natural experiment occurring in Marin County over the past 6 weeks, because there have been schools over the past 6 weeks that did not have masking outdoors. So some of you may be part of schools where kids or students were already not wearing masks outdoors because the school itself didn't adopt an outdoor masking policy. And we saw no additional clusters or outbreaks in schools where masks were not worn outdoors. So that further endorses this shift. Okay, you can jump ahead. So we just, this is just the vaccination status update. So it doesn't change anything from the governor's announcement. We just kind of corrected the due dates and removed the due dates here on vaccination. But our recommendation is everyone, once they become eligible, should consider vaccination. And we have now updated our dashboard to have the vaccination status, which we'll see at the end of this presentation. Right here at the end. We're already here at the end of this presentation. So I was talking on an earlier meeting today. So we have 97% of our schools reporting, which is exciting, but it's not an A+ at Catholic school. It's only an A. So I'm not that excited about it, but I am honestly really proud that we have 97% of our schools reporting, and more proud that we have 95% of staff at those schools are vaccinated. That is probably our highest vaccinated sector in the entire county. So it's something for you all to be proud of all of your colleagues and the schools themselves in supporting vaccination and creating the safest possible environment. And to feel reassured also in most of the school spaces that you walk into, the majority of people that you'll be encountering are going to be vaccinated, as including students, where we see we're still right now using the county level data because the under 12 population is not vaccinated, but we have 84% of our students are fully vaccinated, those students who are between 12 and 17. And if you look at the state and nationwide, we are far exceeding state and national averages for vaccination of that age group. So we are one of the safest communities you can come into in the world, honestly. So something to be proud of. And this is what I mentioned earlier. We have not seen a significant increase at all over the past couple of weeks in suspected student transmission. As I previously mentioned, we were overcounting in many of these cases because we were able to deploy testing strategy that we didn't have last year, where we were going on site and testing after we learned about exposure events, and there are a lot of incidental positives. And so what this slide shows me is that now we're up to 200 cases. And so the rate of the increase in cases per week has gone down significantly. And then we're not seeing any jump in student-to-student transmission over the past couple of weeks. So we have a very, again, just really shows all the hard work of at every level of the school organizations of creating safe school communities, and it's working. And we're almost 1.5 million student days. That's exciting. Here's your slide, Mike. Or I can do it too.
Okay, well, I mean, yeah, you see the numbers there. So we dropped a little bit. We've been doing about 100 tests being reported per day. And so we broke over 1,000, and you can see the positives is a very small fraction of the total test. So we're continuing. The main request we have of all the schools is to help us by making sure that any staff or students who do use these tests use the QR code to report the results. We are actually uploading those results onto the Primary Health web platform. So thanks for your participation, getting some good data out of this.
And this, just to point out this for this group, and I haven't mentioned it publicly yet, what we're seeing is when people are symptomatic now, it really isn't COVID-19, especially in our student population. And we think we are under testing for flu, and we're under testing for other diseases because of one, that it's so available just to get a quick COVID test. And that's what people are really focused on, is just knowing if they're COVID or not. So we probably have under testing for flu right now in our community, which is affecting our surveillance of flu. Around the state, we're seeing higher levels of RSV, rhinovirus, other coronaviruses, enteroviruses that are all producing these symptoms. And so for us, if you remember in the past, we shifted when we moved to the yellow tier, actually even to the orange tier, not to require COVID-19 testing for runny nose and headache. We only were requiring it for what we call the kind of classic symptoms of COVID-19, which is fever, cough, sore throat, loss of taste and smell. And so this is something that we're not making the change yet. We're still we're dragging our feet a little bit and being conservative, but you can see the burden of testing when we're not identifying a lot of cases. So we're still want to err on the side of caution with runny noses and headaches for testing, but it's something just for this group to be aware that this data is suggesting to us that we may be approaching time for relaxing some of our testing recommendations, but we wouldn't do that until we would make the earliest we would make a shift would be when we move into that 3 weeks of stable, moderate transmission. Jump ahead. And this is this is just a descriptive slide for what we're trying to do, is just onboarding everyone into that testing platform. It gives us supply. One of the primary reasons that ensures access to a free supply of testing for our community. And two, it has a sufficient and a stable platform for reporting all of the results, which is important for us as well. So I think this might be the last one. So thank you.
So we have a chance for a few more questions. Oops, sorry. And Morgan, I know you sent us one ahead of time. So do you want to go ahead and ask that question while we have others think if they've got questions as well?
Sure, just a simple logistical question. Our site's been keeping, unlike most of the schools in Marin County where the classrooms open to the exterior, in the two San Rafael high schools, the classrooms all open to interior hallways. And we've been leaving the doors to those hallways open to improve ventilation, but it means that leaves and garbage are blowing in. So the question is, are we getting enough added safety by leaving those doors open that it's worth the custodian's time to clean it up every day? Or is that really such a minor marginal improvement that we shouldn't worry about it?
I would say we would not be recommending that maximal ventilation anymore. So it really is up to the individual school and managing that space. And I think that's because we're in such a different space than we were at this time last year with the vaccination rates in those secondary schools, with the mask wearing indoors, and with what you're seeing with the level with testing availability and case finding capabilities. I think these are all of those kind of that multi-layered strategies. So I don't think I would say it's limited benefit for having that full windy corridor, especially today, on days like today. So I empathize with your maintenance staff today.
Do you mind if I ask another question while I've got you? Thank you. So I wanted to drill down on the indoor, if students have to eat indoors. We know, we'll probably have smoke days coming. We've been lucky so far. We'll definitely have rainy days coming. You said they need a seating chart. That's really not practicable in the high school level. I can understand elementary kids might eat at their seats in their classroom. I don't see how we're going to make that work in the high school level. Can you just explain a little bit more what it would look like when students need to eat indoors due to weather or air quality?
So yeah, so on the high school level, I can speak specifically to that. What we would expect is that we would have an exposure event indoors during eating, which is a higher risk activity, and we would have the majority of individuals would be undetermined contact. So we would interview the positive case, ask who they were eating with, the individuals that they identify who they ate with. The next step would be then checking their vaccination status. If they're vaccinated, they would just be told to monitor for symptoms. If they're unvaccinated, that would be the only group that's excluded. The rest of this is where we probably would do just a broader notice of anyone that was in that lunch period and potentially in that lunch area would get an exposure notice. Not that they're quarantined, but they would be, whether they're vaccinated or not, they would get a recommendation to monitor for symptoms and the recommendation to get tested 5 days after. And that would be a scenario, that specific scenario, and I think we just had one, would be one where public health would come on site and potentially just be there on day 5. So we can just maximize testing availability at that type of exposure.
So I'm just thinking, how do you operationalize this? So what I'm envisioning is something to the effect of like, everyone keep track of who you eat lunch with. I mean, students know who they ate lunch with, so that shouldn't be an issue. And any indoor space probably needs, particularly like a closed indoor space. You got a cafeteria with a bunch of doors open. It might, like our cafeteria, the whole wall opens up. It might as well be outdoors. But closed indoor spaces like classrooms, you probably want some kind of a sign-in or a photograph of the room. So there's some sort of a record of who else was in that room at that time.
Yeah, ideally, even if you're not recording who sits where, just to know who was there, because then it just reduces our notification.
Right. So we may need to put sign-in sheets on classrooms or other indoor spaces. Okay, thank you.
That's a great question. And these questions are great because I think that helps people think about how, what's the lowest. We don't want to create significant administrative burdens. And we know, especially the middle and high school settings, it's just more open.
It's a massively different problem to solve in elementary, and the policies that work at elementary don't work at high school and vice versa.
Yeah.
Bigger kids, bigger problems. Bigger students, bigger problems, Morgan.
Less frequent though, less frequent problems. Bigger, less frequent.
So Morgan, yeah, thank you. Those are great questions that help us sort of work this stuff out. So very good. Any other questions at this point? Well, we've covered the questions that were in chat. So I think maybe we could wind the meeting down just with another reminder about those two very important panel discussions for parents who are considering the opportunity of vaccinating their children between the ages of 5 and 11. That starts this Wednesday at 6. And then another one next Wednesday at 6 that will be in Spanish and translated into English. Please share that. We are getting questions and calls from parents. We know that they want this information. So please do move that out as best you can. And then in the meantime, we will thank you very much for being with us this afternoon. And I'm sure we'll be seeing you again soon at one of our other public health updates. So thanks to you all. Have a great evening. Go Giants. Bye-bye.